Hey guys, so I want to talk to you about health and fitness because it is right for life, fit for life. But I want to talk about it in a little bit of a broader perspective. And I want you to take in what I'm saying here about what's happening in our country. And I say our country, this is aimed more towards Americans, specifically even more aimed towards people living in California. And what's been happening is we've seen a incredible amount of decline in our access to adequate health care. Most people are underinsured or uninsured. That those rates are going up. And even when we had Obamacare, it was a watered down insurance plan that didn't provide much. And I could tell you from hands-on experience, discharging a patient from the hospital, needing to get them home oxygen, where an Obamacare plan just didn't cover home oxygen. Go figure. So they loosely wrote that, and it was more about a money grab to make middle class. They were concerned about paying extra taxes to pay for our failing Medicaid programs. And in California, it's called Medi-Cal. And that's where I'm going. Medi-Cal is failing in California. The federal government recognizes that. They've been auditing us. They are asking, where is the money going? It's the money federal money gives money to the state, and the state is supposed to manage that money for the Medicaid population, but they basically squandered it. And why I'm saying that, and let's look at this in a broad perspective. Look around your community. Look around where you live, anywhere in America. Do you see more hospitals? Do you see more clinics? Do you see more education geared towards your local colleges graduating local physicians and nurses? Do you see more access to care, or do you see less access to care? So let's look at this. While the spending, taxes, money has gone up in our system, the access has gone down. And it's because there are too many people making money in the middle. There's too much fragmentation in the system that I think has been made that way because the politicians that are supporting these huge health plans and health organizations, managed care organizations and managed service organizations are basically supporting them because they're being politically supported, and they know that those companies are making a lot of money in the middle. Some of our highest returns on publicly traded companies are in the healthcare industry. They have the highest returns. So when you look at it from that aspect, who's really suffering? You and I in our community. You and I that have less access. And here's another thing I want to point out. Why is it that most every other company, and let's take a really good company that has been enterprised and is around, and we've all heard about it, and we probably all carry a AAA card, right? The towing. You just get it for the towing. Maybe you don't have the car insurance, but you just have your AAA card for in case of emergency. Now, number one, we shouldn't be treating our health plan like that. It's not a AAA card because there's maintenance involved. But the AAA card has a toll-free number and an app and everything else. You will talk to a live person, or you will get to a chat box and then go to a live person within 30 minutes. Within 30 minutes, you will have somebody that can come and tow your car, change your flat, jump your battery, whatever it takes. You will have somebody giving you an answer and giving you a Uber type of connection to show you when they're going to arrive. Yet our healthcare is back in the dark ages. Try calling that phone number on the back of your insurance card. Try calling your doctor that is considered your primary care doctor or your principal care doctor, or however you want to call him, your primary. Try calling them after hours. See what happens. Does he call you back? Does anybody in his office call you back? And if they do call you back, do they know that you just got discharged from the hospital? Do they know that you just changed medications? Do they know that you just got diagnosed with diabetes and you're concerned because you just got on an oral diabetic medication and you're having some side effects? Do they know any of that? And why shouldn't they know that? And I'm saying they don't know that because we've created too many middlemen. They don't feel that they should know that is because we don't have any oversight and enforcement to where that money's going. So the money's going from the federal government to the state to LA Care or Anthem to a medical group, and they're not doing anything. They're dropping the ball, and you and I are suffering. And then on a broader perspective, they're allowing hospitals and clinics to close down. Why aren't they supplementing those hospitals and clinics to keep them open? Why are they letting them shut down? And I know from a personal standpoint, from my career, they scrutinize every claim that we submit into the health plan, and they try to pay pennies on the dollar on that reimbursement. And sometimes they arbitrate that in court and they don't pay us anything. They win the case and then they drill it down and they're not going to pay anything. And sometimes, yes, it's fair because that person probably should have been discharged, but we're still stuck with them. There's laws. We cannot kick out people to the street. So I'm just saying something has to change. I'm going to try to change it, and I'm going to try to educate people and let them know how they can protect themselves and how they can escalate things and make change. And I'll talk to you guys later. Thanks for watching.